Last night's big story was about the Oregon State Hospital in Salem and how new rules are now in place when it comes to who can be admitted there. In recent years, there's been a huge increase in the number of aid and assist patients receiving treatment there. Those are people with a mental illness who've been accused of a crime and are awaiting trial, but are not able to aid and assist in their own defense. As more and more of those folks are waiting to get into an open bed at the hospital, they're often left waiting in jail cells. A series of court rulings say those defendants can only be held in those cells for 7 days before getting treatment at the state hospital. But right now, the average wait is over 2 weeks. At one point, it was over a month. So the battle between getting people in and out of there faster while trying to make sure it's safe for them to be in the community they came from has been ongoing for quite some time. And our story last night detailed the latest changes. The new rules allow for more notice when someone is being released from the state hospital. It was 30 days, now it's 60. The rules also allow the DAs to ask that the patient be held longer than previous stipulations, in some cases up to 3 years. And it limits who can be sent to the state hospital. People charged with non-person misdemeanors or misdemeanor crimes that were not against a human being, well, they're not going to be admitted, and they have to be treated in their local community. We asked for your thoughts on the changes, and several of you pointed back to what you see as the root of the problem that began back in the 1980s. Jim wrote to us to say those of us over 70 can look into the Wayback Machine and remember the darling of the Republican Party, Ronald Reagan, who defunded public mental health support in the 80s, and the problem has grown ever since. What goes around comes around, and often comes back to bite us. We even heard from a viewer named Joanne who says she used to work inside the mental health facility herself.
We were hamstrung on a lot of things. At a certain point, if there's no judge keeping someone in, we had to let them out as long as they had a plan, whether they were better or not. Unless there was some kind of legal thing to keep them in, if they had a plan, I'm going to go eat at this food kitchen, and I'm going to sleep over there on the street, and I'm going to get my mail here, they could go because we couldn't hold them. I believe that our laws that we have, which were well-intentioned, need to be worked over, and we need way more mental health because a lot of people out there used to be in the mental health facilities, and they're now out there.
And we do see them. The people I spoke with for our story say there does indeed need to be more places for people with serious mental illness, both at the state level and the local level within our communities.